In this morning's Health Watch, quitting smoking. The CDC says smoking is the leading preventable cause of death, killing more than 440,000 people in this country every year. Dr. Richard Hurt of the Mayo Clinic is here with a treatment plan that just might work for you. Good morning.
Good morning.
Why is it so hard for people to quit?
Some people are wired differently. It's all has to do with the receptors in the brain, and some people just get more receptors that get upregulated, and they create more of a craving and urges to smoke.
You were a smoker, and you quit, and this is part of what precipitated your interest in this, right?
That's correct.
Right.
I went to the Smokers Clinic back in 1975.
What is it about your program that seems to work so well?
Well, we incorporate behavioral treatment, addictions treatment, pharmacotherapy, and relapse prevention. Those are the four things that make our program special. But we have individual counseling, but we also have a residential treatment program for patients who really need to stop smoking. It's an 8-day long program. They're immersed in this, and it's a very effective program.
So if you're really serious about it and maybe have had trouble quitting in the past, I know when I quit many years ago, it took a half a dozen tries at least.
Well, it does, and a lot of people try, and if they can't stop smoking on their own, then there is treatment available.
All right, so assume I can't get to Mayo Brothers for a week and do this thing. What can I do on my own to help quit smoking?
Well, there are several things. So every state has a telephone quit line. So you call 1-800-QUIT-NOW, and that's a number that you can get counseling and sometimes get medication. There also is an internet program called becomeanx.org, which is a free internet program that we have developed the clinical material for, and it's really a great program.
In terms of going about this, can you do it by yourself, or does it usually take some sort of cooperation? What do you need to do in terms of your local environment to help people? What's the best thing you can do to get
Well, you
yourself
have to change your environment because there are people around you who smoke, then you need to ask them not to do that. And so if you have the ability to change that environment, that's a good thing.
Right.
Trying to stop on your own is very difficult, and there's a lot more tools now than we've ever had before. There are 7 different medications that we have. We have the telephone quit line, we have becomeanx.org, which people should avail themselves of, or even just talk to your physician.
And finally, last but not least, how important is it to quit? Because it can completely change your life.
It is, and so this is a product that, if used as recommended by the manufacturers, will kill 60% of the customers. So left untreated, tobacco dependence is a very serious problem.
Dr. Richard Hurt, well said. Thanks so much. Appreciate
you.
it. For more on the Mayo Clinic smoking cessation program, go to our website. That's earlyshow.cbsnews.com.